Hi, this is Jessica DaMassa with WTF Health, and I am here with Sarah Holoubek. She is the CEO of Luminary Labs, and I understand that you are the woman to talk to about open innovation in healthcare, and why is that?
We recently surveyed 60 plus participants in challenges that we have run at Luminary Labs. These are open innovation challenges where after an open call for entries, anybody can submit a solution, and a narrowed down pool of 5 gets seed money and access to learning, and then a grand prize winner will take home the remainder. We asked them, where are they today? As we saw, for example, back in 2011, companies like Ginger.io winning a challenge and subsequently raising, say, $20-some million. So we surveyed these teams, and we found that collectively, they have gone on to raise over $100 million. Only one of the teams that was a prize winner abandoned the solution. Most of them continue to develop it, or to fold it into another product or service.
Okay, so open innovation challenges are a good predictor of success in this space, you think?
Well, I think it's a good mechanism.
Okay, so talk more about that.
It's sort of like a strategic intake valve for new ideas, concepts that might solve a business problem you might have. So, for example, we recently ran the Alexa Diabetes Challenge on behalf of Merck.
Okay.
And the idea here was, how would you use the Amazon Echo and its underlying voice-enabled technology to develop solutions for people living with diabetes, right?
Okay.
So this was brand new, using the idea of voice, coupling it with health, and seeing what could possibly be considered like a concept car challenge.
Sure.
And the winner, Ann Weiler of Wellpepper, her solution was SugarPod, is speaking at the conference here this week. And, she presented a rather novel solution that typically within the 4 walls of any given company, you would not have come up on on your own.
Okay, so, the thing that's intriguing to me about this is, I want to find out, what else you learned from this study. So you surveyed quite a few companies. So, what are some of the things that these startups that participated in these kinds of challenges had in common that you think made them successful?
Well, I'll tell you something that might not predict their success, but I'll tell you why they entered.
Okay.
If the solution was mature when they entered, they were very interested in the money, the prize purse.
Okay.
If the solution was more at the concept stage, they were interested in the learning opportunities, the proximity to the sponsor, as it relates to the challenge. However, on the flip side, after they completed the challenge, they said that the most valuable component was the learning. So prize money is very important. It's an incentive to get people to participate.
Yeah.
However, it is really learning that makes the difference. So what they have in common is the ability to iterate. And so we've seen companies that through a virtual accelerator or a boot camp that is part of the challenge, teams might entirely pivot. They might focus on a different disease state, and then they go on to win the challenge, which is non-dilutive capital. They are winning hundreds of thousands of dollars with no strings attached.
So do you think most sponsors of these challenges, like the pharma companies or the big health systems, do you think that they understand that about the learning component of it? Or do you feel like they're just we need something, we're going to put X amount of dollars on this. Yes, this is brilliant.
You hit the nail on the head. They think, what is this virtual accelerator thing? Why would we do that? Couldn't we just make this a little bit shorter? We said, well, you could, but you have to design a challenge around a business problem. What is the real problem you're trying to solve, and design for outcome? And if you just want to give money away for ideas, then absolutely just give money away for ideas. But you actually want to see a prototype. You want to see something become market ready. You want to see them close the gap between concept and viability. You have to give them resources beyond just the cash.
I want to talk a little bit about problem definition real quick. Do you think that in healthcare we're very good at this from where you sit? Because I get mixed responses to this question. So from where you sit as somebody who's running challenges and working almost as a mediating body between big pharma and then the startups that are trying to solve these challenges for a population that may or may not even be engaged in the conversation, the patient. Are we good at defining the problems behind these challenges, or what? I'm sure the ones at Luminary Labs are great, but generally speaking.
In general, nobody is good at problem statement definition. So when it comes to innovation, oftentimes we get distracted by shiny objects. Tell me about VR. What could I do with voice, the blockchain? But what is the problem you're trying to solve? If you start with the problem and you articulate the business problem, do you have a business problem with blockchain? No, because you haven't done anything. What is the real business need you're trying to solve? And in healthcare, typically it's also going to go back to a real patient need. And 9 times out of 10, even the startups have not talked to enough people to understand what the real wants and needs are. And so problem statement definition, and we could run a problem statement definition workshop even before we get to challenge design, is a really good idea.
All right, Sarah, so you work with a lot of startups in this space. So tell me, what is your best advice for startup companies that are looking to get into health tech?
Well, first, talk to real people, the beneficiaries or users of your product or service. So, all too often, we find that startups aren't connecting enough in real life, not having conversations with these people.
Yeah.
And so, start there. Start with the real human need, and then consider how your technology might solve the problem. But also consider how it works out in their daily life. Where is it appropriate? If you're solving for a clinician, where is it in the workflow?
I'm going to flip it the other way too and ask for some good advice for some of these big companies that are like, oh, I want to just go and acquire a startup, or I want to work with a startup because I don't want to develop my own platform. So what's your advice for them?
Well, the same advice I give year over year is have a common investment thesis. So most large companies will have numerous teams, innovation teams, maybe a venture fund, maybe there's a challenge team. You'll have business units all doing different things. And how much more powerful would it be if everyone agreed on a common investment thesis? We know our business model is changing, and therefore, where is our big bet? If you want to have a couple of big bets, that's okay, but make it abundantly clear so that we're all going in the same direction. From there, you can then begin to identify the right teams, decide if you want to build, buy, partner, and pilot, but you're doing it with this common sort of long-range view versus just scattershot, ending up with like pilot fatigue.
Yes. Yes, that is a real thing in this space. Yes, I think Esther Dyson is the one who's like death to the pilot in this space, right?
Yes, absolutely. No more pilots.
No more pilots. All right, last question for you. So we always ask everybody on WTF Health, what is the future? So what do you think the future is in this space? Do you think that we're going to continue to see a lot of innovation between big companies and small startup companies, like in the challenge space, or is that whole way that startups and big health companies, is that going to change?
Well, I would question, what is a startup?
Okay.
I mean, is Google a startup? No, it's big tech now.
Yeah.
But 20 years ago, it was a startup. And so I think if we look in the long term, if we want to know the future, 20 years from now, there's this very small company today that will be the next Google. And so rather than seeing it as a big company, small company dynamic, I would look at it as an ecosystem, right? And so I do believe that uncommon bedfellows are part of the future. It will come out of left field. It'll maybe even be somebody who is completely not familiar with the healthcare space.
Fantastic. Well, I look forward to seeing that. Thank you so much for your time and for joining us here. It's a pleasure to speak with you. Thank you so much. This is Jessica DaMassa with Sarah Holoubek from Luminary Labs for WTF Health. Thanks so much.